you very much, Minister of Health of Canada, Philpott, for giving us some minutes to address the Latin American physicians. I know you have a very good experience as Minister of Health. Pedro Cahn has spoken very beautiful words about your work. And I would like to ask you, what would be your advice to other ministers of health in the region regarding the 1990 rules that have been set by UNAIDS?
Well, thank you for the opportunity to share a few ideas from Canada. And of course, we're here at this important international meeting on HIV and AIDS. We've heard from countries around the world who are facing this threat. It's a public health threat that we need to face collectively, and we need to face it head on. And we've seen how many countries have embraced the target of 90-90-90. And we've seen the kind of political will that requires for a country to realize that we need to make sure that people know their status with regard to HIV, that they get on treatment as soon as possible, and that they get that virus under control, that it would be suppressed. But that takes everybody working together. And I think that was the real message that we heard here today. We heard about the focus on key populations, how people need to look at what the virus looks like within their context, and they need to have the determination. And I certainly was impressed with some of the speakers today, including some from Latin America, and I hope that all of the countries of Latin America will get fully on board with these targets. And we need to eliminate AIDS as a public health threat.
And if you would have to tell us what were your practical actions when you took office?
Well, I'm very pleased to be the Minister of Health in Canada under the leadership of Prime Minister Justin Trudeau, and we have a policy or an approach to public health issues to make sure that they are based on strong evidence and science. And so all of our policy around something like HIV, we know has to be firmly grounded in evidence. It needs to also be comprehensive, and it needs to be collaborative. And so we started to look very early on, working with our partners in the provinces and territories, working with our Public Health Agency of Canada, which plays a leadership role in this, to make sure that we're focused on prevention, treatment, care, and support for people living with HIV or at risk of HIV or affected by HIV. Some of the initial measures that we took were on the area of harm reduction, and so we know that, for instance, people who use drugs are often at risk of spreading HIV within their communities. So we've instituted a number of measures to make sure that we have needle exchange programs, for instance, under a supervised consumption approach, and that those kinds of approaches to harm reduction are one of a whole basket of tools that are required to address this public health threat.
And during your presentation, you mentioned some issues regarding First Nation Aboriginal population. Could you comment on that?
Well, what's very interesting about HIV is that you have to look at your particular context and who are the at-risk populations within that context. We know that there are key populations. Of course, gay men and other men who have sex with men are one of the common at-risk populations, and sometimes it's women and girls in certain contexts. Other times it's people who use injection drugs. One of the at-risk populations that we face in Canada is the Indigenous peoples of Canada, who are at higher risk and have higher rates of new infection. And so we will be working with our public health experts and clinicians and researchers in the country to make sure that we have techniques that will allow us to work alongside First Nations leaders in the country to make sure that we address this particular population.
I thank you very much for your time.
Thank you.